We all recognize them, toxic patients who immediately trigger our emotional response with their negative thinking, their negative comments. They want to draw us into their negative emotions. Let's talk today a little bit about the toxic patient and the doctor-patient relationship. Hi, I'm Dr. Jeff Crane, and I want to share my over 30 years of experience as a primary care doctor, both in America and here in Ukraine, of how to deal with toxic patients. I come to you with a worldview that's theistic, that believes that God has given to each of us inherent worth and value. And yes, I believe that even our toxic patients have value that we need to find and develop when they're toxic, so that we can help calm down the situation. Let's unpack this. What are some typical toxic behaviors in patients that come to the doctor? The most obvious is anger, and sometimes this anger turns into violence, destruction of property. Legal matters can sometimes come out of this encounter. Another common one is blame. So anger and blame are the most common ones, but there is also attempts to humiliate. There's a common theme behind this. It's the desire to manipulate emotions, to draw you into the drama so that they can control the outcomes of the situation. In dealing with toxic patients, it's critical, essential to realize that there are reasons behind the anger, the blame, the humiliation, and emotional manipulation. If we understand those reasons, we can more skillfully help them to calm down and to get what they need in the healthcare system. There's one main reason that patients are toxic in their behavior, and that's pain. Pain from loss. They feel a betrayal, either of the health that they wish they had, or betrayal by the caregivers in medicine that should have taken care of them. They may have been charged too much money or had a side effect of a medication that you prescribed. In any case, they're retaliating. They're acting out because of that pain and that hurt from loss. So those pain, loss, and betrayal features need to be seen as the underlying reason behind the toxic behavior. Some would focus on this need to nurture the pain inside them as narcissistic behavior, but I would prefer to see it as a cry for help. I think our patients often come to us asking us to help them with feelings and deep needs that they cannot articulate. Let's use a case study to illustrate what we're trying to talk about with the toxic patient. We'll call him Mr. Yikes. Mr. Yikes saw you last week after several doctors before you failed to diagnose his recurring pneumonias. All of his x-rays were normal. You found, after you skillfully ordered a CT scan of his chest, that his reason behind the pneumonias was a cancer. He had post-obstructive pneumonia. It's taken a few months to get to this conclusion because you're the last in a line of 6 or 7 doctors. He's yelling loudly at you, the staff in your office. He's telling the patients in your waiting room that you're all doctors and you are incompetent. He's going to bring legal action, send his doctor to sue you. Now let's look at the toxic features of Mr. Yikes' external reaction. He has excessive anger, and it's free-floating, non-discriminate anger directed at basically everybody. He's using the reaction to bad news to create drama. He's wanting to manipulate and to control the environment. He's blaming you for the failures of others, and he's threatening in retaliation. Those are the features of his reaction. Now let's look at the reasons for his reaction. There's one main reason for his reaction. It's grief. Grief is a reaction to loss, his loss of health, his loss of control. This image basically diagrams the simple grief reaction, starting with denial, and then anger, then blame, usually results from the anger. If we understand that this reaction of Mr. Yikes is not just toxicity, but is actually pain and anger from grief and loss, then we'll be able to understand how to help him. Now, let's look at a wrong response to Mr. Yikes. A wrong or bad response to Mr. Yikes might look something like this. Mr. Yikes, you have no right to yell at my staff. Sit down and talk to me. Let me get your attention. You should be grateful that we're trying to help you as doctors. You know that I've arrived at a correct diagnosis. You need to either calm down or go find another doctor. Certainly we'd have the right to respond emotionally like that, but that would be very destructive and inflammatory. It would cause him to get even more angry. Now, a good response to Mr. Yikes will involve empathy and empathic listening. It might go something like this. Mr. Yikes, you must feel very angry right now. I understand that this is painful for you. I understand you probably did not expect this kind of news. You must have some more important things to do right now than worry about a cancer diagnosis. I want to assure you that I understand your problem, and when you're ready to talk about it, I think we can help you. This kind of response helps him to feel understood and to begin the catharsis that he needs to have to deal with his anger in a positive way. I really like this quote by an Australian holistic family psychologist, Ashley Warner. It reads like this: "Beneath every behavior there is a feeling, and beneath every feeling is a need. And when we meet that need rather than focus on the behavior, we begin to deal with the cause and not the symptom." Helping our patients find the real causes behind their emotional feelings of pain and anger is what we must do as good primary care doctors and specialists in medicine. Every good doctor should know how to do this, and it's much more effective, yielding far more permanent and lasting results than prescribing medications. In summary, our patients come to us with pain and grief, with loss of health, loss of control, and many times this comes out in toxic behaviors. Don't react to those. Rather, listen with empathy and try to recognize that they are worthy of being understood by you as the doctor. Thank you for listening.